Quality is super important right now because you don't really want any doubt about whether a case is positive or negative. You want to, as effectively as possible, rule out the possibility of COVID-19 in the patient sitting in front of you. The test is only as good as the sample, okay? So you have to get a good sample going into the test. Bad sample, bad result. But in the face of that, you want to apply the most sensitive technology you can, because we know that samples are never perfect. So they get collected from the wrong site of the nose, and they may not be perfect when they come out of the patient. And so having a really sensitive technology enables you to still get good information from a sample that's not perfect. And that depends on sensitivity, sample collection, and overall performance of the combination of those features. What the Cepheid cartridge does really well is take a relatively large volume of sample, extracts it into a very small volume, and then takes most of that extract and puts it into the final reaction chamber. So you don't lose stuff along the way. You'd like to get what's in the original specimen into the final reaction chamber as efficiently as possible. And that's what we've done over time. We've had many years of experience of doing that. And being able to maximize the nucleic acid in that original specimen, its presence in the final reaction chamber is a key attribute that makes us really sensitive. There are a couple of recent studies published in the Journal of Clinical Microbiology, which is the most widely read journal in our professional space, documenting the performance similarities and differences of the different technologies. We're consistently seeing that the Cepheid test performs against the best-in-class molecular platforms that are out there. What they're seeing in these studies is that the large central lab systems are performing quite well, and our test performs essentially identically, if not a little bit better, than most of the central lab systems. Those are the gold standard systems for sensitivity. Those are the systems that we use really with confidence to rule out coronavirus. And our technology performs at that same level. What they've shown is that some of the other point of care options that are being used do not perform to that level of sensitivity. And that's been a pretty consistent finding with all these studies that have come out recently. Northwell in New York City, which did a head-to-head comparison of the Hologic system, the Gene Expert, the GenMark system, and the Abbott ID Now system. And in those studies, the Hologic and Gene Expert systems were very similar in performance as sort of the gold standard reference method, whereas the other two systems, integrated on-demand systems, did not offer the same level of performance. The confidence you get out of a good sample put into a good test provides a lot of confidence. It provides confidence that it's not coronavirus. It provides the need to look for other causes, perhaps, in the case of a seriously ill patient. It also provides the confidence of not requiring respiratory isolation and personal protective equipment for that patient. It provides the confidence in being able to put them in the right place in the hospital or to send them home with a negative result or a positive result with the appropriate level of isolation for that patient. So the confidence allows you to take the right level of action on an individual patient level.